Hi everyone. Today I thought I might talk a bit about something that a lot of guys are a bit embarrassed to raise. It's about erection problems, erectile dysfunction, and those sort of issues. So, in my practice, I get asked about these things a lot, but I know a lot of people are reluctant to actually raise it with their doctor. So, firstly, obviously, I think you need to find a doctor you're comfortable talking about these things to. Whether it's your regular doctor or you might want to find someone else who might be better for you. Um, and I think the first thing that comes to mind is when people say they have erection problems, usually it goes into like two categories. Firstly, is it about people not having interest in getting erections? So, loss of libido really, or is it actually physically having difficulty getting the erection itself? So I think there's two different things. I mean, if it's a lack of interest, maybe it's other issues, psychological issues, maybe it's just who you're with, maybe it's anxiety causing that, maybe it's fatigue. Also, sometimes things like hormone issues could cause that too, so it's worth exploring a bit further. However, if you actually have true erectile dysfunction and you have trouble getting erections, I think it's worth talking to a medical professional maybe about exploring the reasons behind it. First thing to say is it's very uncommon for erectile problems to be caused by something physical, so something wrong with the penis that means they can't get erect. It's more commonly caused by other things, so often it can be treated or talked about a bit more. I think the main cause that I see is, even for erection problems, is actually more psychological. Often it's anxiety or depression that's actually affecting people's erections, and that happens really commonly. If people are feeling very stressed, they might find difficulties getting erections. Performance anxiety is a common issue too. I think if you're really stressed about being able to perform, then it can cause problems later on. One common thing too is that you might have problems with your erection at one time due to something different. Whether you've been really tired or had too much alcohol or other substances. And if you were unable to get an erection then, sometimes it forms a bit of an anxiety the next time you want to have sex, and you might have more trouble because of the anxiety caused by that. So again, it's worth talking through all those things. There are some physical reasons why you might not get erections. You might have hormonal issues, things like diabetes. There might be things that affect the circulation to the actual penis and the tissue that actually gets engorged. So I think it's worth going to your regular doctor, GP, and talking through these issues a bit. In terms of treating it, the common treatment most people use is things like Viagra, which are called the PDE inhibitors. So the oldest one is Viagra, there's Cialis, there are a few other ones on the market now. There's not a big difference between them. Cialis lasts much longer than Viagra does, but they work on the same mechanism. Again, they help just the tissue in the penis getting engorged with blood. They do have known side effects, flushing in the face, headaches, low blood pressure. So you do need to talk to your doctor about it to see if it's suitable for you to use these medications. And they're very available, and doctors will be quite happy to prescribe it. So there's no real reason to buy it, off the black market or anything like that. And they're not that expensive anymore either. The other group of treatments is more the injectables, which is Caverject and Trimix are the common ones people use, where it's actually injecting into the penis to actually cause an erection. These always work because you're injecting directly into the penis, but it's got the added side effect where you might get a prolonged erection that becomes a problem. So if your erection doesn't settle down, let's say for about an hour, you could cause damage to the penis itself, so you need to have treatment. So again, before you embark on any of these, please speak to your regular doctor about it or someone who knows about it, so you can use it appropriately and reduce any significant side effects from it. So really, I'm saying that you shouldn't be embarrassed to talk about erectile dysfunction or what you think might be erectile dysfunction. It's quite a common issue that doctors deal with anyway, and we know what things we need to explore and need to talk to you about it. Sometimes even if people have slight psychological barriers to why they're getting erections, we often would use medications like Viagra to get you over the hurdle a bit, because I think sometimes it does help. The use of substances like amphetamine-based things makes it harder to get erection, but for some people they use it to have sex. So sometimes it's there are some issues with people I know who've had, for example, had crystal with sex for a long time, and they find it very difficult to have sex without crystal. So that sometimes is partly an association with the drug itself, so it can take a bit of work to actually get through some of those issues. So sometimes it's very simple, sometimes just a simple medication will help, other times you need to talk to someone a bit more to try and explore it further. But please don't be embarrassed to talk about it. You should feel free to talk about it to either your doctor or you find another doctor whom you can talk about, about these things too. All right, till next time.